Hello, my name is Richard Tuttle, and I'm a first-year medical student at Wayne State University, and I'll be presenting today on an evaluation of cost effectiveness for corticosteroid versus hyaluronic acid knee injections specifically. Now, to begin, our study focuses on addressing a certain issue called osteoarthritis, which has become one of the most costly medical conditions in the United States, specifically for the older generations. Now, before many people want to take on such a lengthy procedure as a knee replacement or a total knee arthroplasty, they often refer to a treatment called intra-articular injections, which are the treatments we're looking at today. So that's going to be our corticosteroid knee injections in comparison to another option for our hyaluronic acid knee injections. Now, many studies have compared these two in terms of how effective they are clinically, but what our study today is evaluating the cost effectiveness, so not only the clinical effectiveness, but the financial value of these knee injections. And our study hypothesized that intermediate molecular weight hyaluronic acid injections will demonstrate the greatest value and the greatest cost effectiveness, meaning that they're able to improve the patient's clinical outcomes as well as be the most effective financially. So what our study did was collect 25 patients for each cohort, 25 patients that have received corticosteroid injections, as well as 25 patients that received intermediate molecular weight hyaluronic acid injections. Now, in terms of analyzing the costs of these treatments, we used TDABC, or time-driven activity-based costs, and which were categorized into 4 categories. Direct labor costs, which are the salaries of those involved, including attendings, the residents, the nurses, medical assistants. We also included supplies, or the actual cost of the injections, as well as the syringe, the needle, things like this, as well as direct fixed, so that's going to be the building and utility fees, and indirect, and that's going to be administration, marketing, communications, and things like that. And in turn, we also assessed clinical effectiveness with what was called the Patient-Reported Outcome Measurement Information System, or PROMIS scores. So the PROMIS scores were in 2 categories: pain interference, so how well did these injections reduce pain, as well as physical function, in terms of how well did these injections improve the physical outcomes for these patients and their physical function. Now, we took these 2 categories and merged them together. So for the PROMIS scores, we extrapolated them using PROMIS adjusted life years, so multiplying it over the course of 3 months in terms of effectiveness to what we call a PALI score. Now, this PALI score, or the effectiveness based on PROMIS outcomes, was then combined with cost, with what we call an average cost effectiveness ratio, or ACER, where you have cost in the numerator and your PALIs, or your PROMIS adjusted life years, in the denominator. So you would like a lower average cost effectiveness ratio, where you have a low cost in the numerator and a high effectiveness in the denominator. So if we can look at these results now, beginning with cost, if you look at figure 1, we can clearly see that corticosteroids have a much lower cost than intermediate molecular weight hyaluronic acid injections. And you may ask yourself, there's a very big discrepancy in the blue section, or the direct supply section, and that can be derived from the cost of the injections themselves. But regardless, corticosteroids are significantly cheaper than your intermediate molecular weight hyaluronic acid injections. As we move to figure 2, we're then comparing the cost as well as the clinical effectiveness to help us look at where these stand in terms of this relationship. As you can see on figure 2, where the y-axis is your cost and your x-axis is your PROMIS adjusted life years, or PALI, we can see that the orange dots, the intermediate molecular weight hyaluronic acid injections, have a higher cost and don't improve as much into the future, as you can see here, where they stay around the 0 mark and progress maybe up to the 4. However, you can see the blue dots have a lower cost, as visible on the y-axis, as well as range to a higher value in terms of their effectiveness over time. Now that brings us to table 1, where we can see a compilation of the data. So looking at our average PALI PI, or for pain interference, we see that corticosteroids in the middle column have a higher pain improvement than the intermediate molecular weight hyaluronic acid injections, according to the PROMIS scale extrapolated over time. Similarly, we see the same for physical function, where the corticosteroids are more effective significantly at improving physical function with that number of 0.71. Now we combine these to our average cost effectiveness ratio, where we see that we have a greater cost effectiveness for both reducing pain and improving physical function with those two numbers, $77.99 over the Pally, as well as $125.95 over the Pally, demonstrating that it's much cheaper with these outcomes to have greater effectiveness clinically. In other words, you have low cost and high effectiveness. Now, we also have the incremental cost effectiveness ratio comparing the two injections, and we can see here by doing this calculation that our intermediate molecular weight injections are worse at improving pain and worse at improving physical function than corticosteroids. Essentially, this study then shows us that corticosteroids are more effective in terms of cost effectiveness. Thank you so much for your time.